The condition that I had was brainstem release phenomenon. It's like where the brainstem constricts and it cuts off circulation to your body. When this brainstem constricts, it makes you have really bad headaches, like chronic headaches. Like migraines, but like worse than migraines.
What Rachel was really, in many ways, very typical of the kind of patient we see, and that patient is someone who has seen numerous specialists, and unfortunately, for a certain small subset of patients, medications and injections and all these therapies we have just don't work, and that was really her story. And sometimes the pain is literally just paralyzingly bad, to the point where it shuts down your life.
We were in and out of the hospital like every 2 days. My neurologist, he told us about this program. He told me where to go.
It's important that the patients understand what we're going to do. The patients are required to attend Dr. Reed's seminar. We see the patients the next day, visit with their family, the patient, go through all the questions that you have. Ultimately, it comes down to the trial. And the trial is essentially a test.
The trial, Dr. Reed put it in and it worked good. Then it took 1 year for the insurance to get readjusted and everything. And then I got the permanent stimulator and Dr. Bolger put that in.
Most of the time, our patients can dramatically reduce, but not always eliminate their medication. In Rachel's case, almost no medications anymore, which is pretty significant. And so she's doing great. I think that she's rejoined the human race in terms of school, activities, social events, things like that.
I got it July 5th of last year, right before my birthday, so it was a good birthday present. I'm feeling really good now. I can do things with my friends and not get tired and get stressed out. I am completely symptom-free. Doctors treated me good. My overall experience was awesome.